Um, Everyone, this is Pete Lom with the Forest Service and chair of the NWCG Smoke Committee. I welcome you to a webinar hosted by the Nature Conservancy very kindly, and this will be recorded. Liz is turning that on as we speak. Duration, probably an hour to an hour and 15 minutes, and I'm really looking forward to the presentation here. Cindy Huber works closely with JFSP as advisors to the JFSP Dry Fire Sciences program on smoke issues. She had brought to our attention this idea of having some discussion on indoor air quality with the folks out of Colorado State. I had spoken with Kris on the reservation there about I had seen a presentation of his this past fall that really brought to my attention some very important findings that he had with heavy smoke issues in the area that he is trying to address environmental health and air quality. And I thought that the combination of this would be a great webinar for the Smoke Committee to sponsor and work and get the word out. I think it's important to the Wildland Fire Air Quality Response Program and the Air Resource Advisors that are out there, Smoke Committee, and basically anyone that's concerned about downwind impacts from wildfires in specific. So I'm looking forward to this, and hopefully everyone enjoys the presentation. And with that, I'll kick it off. And I just want to say thank you to the presenters for your willingness to do this presentation. And I'll pass it over to Liz to pass it to them. And looking forward to the presentation.
Okay, cool.
Be ready to go, Kris.
Yeah, this is Kris Ray. I'm the Air Quality Program Manager for the Confederated Tribes of the Colville Reservation. During this presentation, we'll begin by setting the stage of what happened in 2015 wildfire season. I presume most people on the phone had some effect from that, and this is what happened around here. And we'll talk about some of the indoor air wildfire smoke that I measured during that time, and then provide some of the lessons learned and some steps I've taken to get prepared for the next time. So the Colville Reservation is in north central Washington. It's on the east side of the state. It's on the drier side. 1.4 million acres, so it's a pretty big reservation for our side. It's really diverse. It goes from 8 inches of rainfall to 35, almost 40 inches of rainfall, and from shrub steppe all the way up to the cedar forest. So it's a huge diversity and a big land. So the fire chronology in 2015 kind of sets the stage on how it all came about. It was a drought year, second year of drought year. 2014 was a very bad fire season too around here. So we had very little snowpack, really hot temperatures early, no spring rains to speak of. We knew it was going to be a bad fire year on when the Sleepy Hollow fire started down by Wenatchee's, about 80 miles south of the reservation, and it burned right into town. It burned up 2 neighborhoods there, 29 houses, and then it burned up a couple, a box manufacturing plant and an apple warehouse in the middle of town. So we knew things were different because that shouldn't happen. It never happens, and it is now. It's become standard. Then on August 13th, North Star Fire started on the reservation. It's in the middle of the reservation, just right north of Nespelem, which you'll see on the map where that is pretty soon. That was man-caused, but and then that night we had a lightning storm come through eastern Washington and started a bunch of fires down by Chelan, which is a resort community about 40 miles south of the reservation. The 5 fires formed a complex, and those are the 5 fires that got away. There's hundreds of fires going on at that time, and those are the 5 fires that didn't get put out really quickly. Then on August 19th, the Tris River fire literally exploded. We lost 3 firefighters in that incident. It was really sad, tragic. And then that night, another lightning storm hits a little farther north in eastern Washington, and that started the Okanagan complex set of fires. So those fires ended up burning into one, and they were over a large large geographic area, and those are, again, the 5 fires that nobody got to put out early. And then at the end of the fire season, we had an earthquake right in the middle of the North Star fire. So you can see by the number of houses burnt up, how many acres were burnt up in all these fires, that it was a pretty complex fire season for everybody. So the purple dot in the middle of the screen, that's the location of our Nespela monitor. The green dots on both sides of that are on the west side is the OMAC monitor, and the other one is the Inchlim monitor. They're all run from my program. The North Star fire was just 5 miles north of that purple dot, which indicates very unhealthy conditions. That's the beginning of the fire season, or the smoke intrusions from that wildfire, about August 18th. And that, you know, kind of shows you we were experiencing smoke a little earlier than a lot of places were. So our 24-hour averages for August were pretty startling. You can see almost the entire second half of the month was into the very unhealthy or higher, mostly hazardous, or even up there where there is no words to explain it. So you see the peak on August 15th and 17th. There's a lot of down valley winds. The fire wasn't really very big at that time. It was only 30,000 acres and had about 170 people trying to put it out. So it was relatively small. There's not a lot of resources there at that time. Then look over to August 20th. It's just right there at the very unhealthy mark, kind of the low point in the month. It was about 76,000 acres, and there was 280 people on it. Also, remember that between the 19th and 20th, we had that lightning storm come through, and then that kind of the beginning of the high winds during the fire, rest of the month, actually. So they got bigger quicker because of the storms moving through the area. The flat part, whoop. Did you lose my screen?
Yes, we now have your inbox.
Is that better?
Now we have nothing, so try resharing again.
I don't know what happened there.
Gremlins.
Oh. Okay. I can't even find this right screen.
Oh, hang on a second. It looks like you got popped off being the presenter.
Okay.
Let's try that again. Okay, you should now be able to share again.
Sorry about that, everybody.
Who knows?
So on the 15th and 16th, the 24-hour average was way over 1,000 micrograms per cubic meter. The monitor, the BAM 1020, returns an error message at 985. So, but they were all functioning during that time. So you can see the extreme conditions we had. On the left side is the sampling tape of the BAM 1020. You can see how dark those circles are. This is a picture I took when I was at the site, and the monitor just shut down right about 20 minutes into the hour. And it shut down because they couldn't pull enough air through the sampling tape to not burn up the vacuum pump that pulls the air through there. So that was a safety feature of the BAM, so it doesn't burn up the vacuum pump and ruin a bunch of equipment. And it just shut off. So the air quality was way above 985 at that time. The picture on the right, it's looking towards the fire. The roadblock is there because visibility up the road is about 20 feet when you get around towards the fire a little closer. And Off to the left, about 100, 200 feet, is the fire camp for the North Star fire. So these are the conditions people were experiencing at the time. So about 2 weeks before this fire started, I received a MET-1 Aeroset 831. The light scattering sampler converts it to PM2.5 or PM10. That runs continuously or 1 minute averages. And it's a real basic sampler, but it really fit the need, and it had good reviews, so that's one reason I chose it too. So I had a really sophisticated sampling plan when I decided to go around to the buildings in our government center and find out what the indoor air quality was like during these heavy smoke times. So I just, grabbed my steno pad, walked into buildings, sampled several rooms, wrote down the concentrations, and was expecting just to walk out and continue to the next building. I just wanted to know what was going on. I was really curious. It didn't quite work out as easy as all that. So some of the measurements I got the first one is my office. It was in a back room of a converted house. I was the first one in that day, the only one in the building, and it read 405 micrograms per cubic meter. And then, some of the buildings were a lot worse. The administration building, a brand new building, was about as bad as you can get. But the newer buildings by code is air in, air out, and there's no recirculation functions there. And it was, at that time, the air conditioner was running, so it caused those high concentrations inside the buildings. So I went through and measured a bunch of them. The clinic was about the best. It had really high ceilings, a lot of space inside. You can see the outside concentration was 980. Then I continued the sampling on the next day, and it was, my office was better, but nothing else was. Child care, the front desk was 599. Usually the closer you get to the front door, the higher the concentrations were, and as you go back into the building and get into some of the back rooms and offices, the concentrations were less. They were still high, but they were less in the closest to the front door. The emergency command center was in the new admin building, and it was where all the decision makers were at the time for emergency services. And it was pretty high, and it caused us to do some management of doors and how people got into the room and into the building from that. The last three of those buildings, I didn't even put a health statement on the side like hazardous, because concentrations are so high, I don't think there was words to describe it properly. And those were the indoor air. So going around to different buildings, I talked to a lot of people and learned a lot about their health concerns. People were really concerned because they were having a hard time breathing. And of course, that was due to the high PM values, but also learned later that it could have been the carbon monoxide, carbon dioxide, and ozone levels that are associated with major fires like this. So that was really interesting. People were experiencing headaches. Almost everybody I talked to had a headache, and partly that was dehydration. It was really hot outside during early in the morning through all day. It's also your nasal passages and throat drying out, and that can also cause headaches. So I gave out a lot of water bottles, encouraged people to wear or to drink a lot of water. About halfway through these fire events, we received a lot of masks to wear, the N95 mask. So I was giving those out to everybody, but people were complaining about it was hard to breathe. And then if they had respiratory problems, they couldn't use them anyway because it would just, they needed the doctor's approval for that. And then based on the indoor air quality concentrations I just showed you, and a bunch of other factors, our administration decision makers gave out administrative leave because it just was not good conditions for people to be working in and around our agency campus and throughout the reservation. So one of the major things also is people are just nervous. There's a lot of anxiety. Everybody knew somebody was being evacuated. They were helping somebody evacuate. They were preparing to evacuate, or in a lot of cases, they just left their house in time before the fire came through and burned it up. So that also added to health concerns, is the anxiety of it. And then people that were healthy started exhibiting what I would consider chronic health problems. A couple days, 3 or 4 days into heavy smoke, they just couldn't breathe, and you just didn't have the energy you used to have, and so that also affected people. And there's smoke in everybody's houses. It just shouldn't have been there, but it was, and couldn't do anything about it. So one of the things I did is I put out a fact sheet for using the N95 mask properly. Like I said, we had a big influx of masks donated from all over the United States to show up here by the palletful. We started giving those out, and they came in a lot of varieties and makes. And so we put out a fact sheet on how to wear those properly, when to wear them, when to change them. And that was reservation specific. This is a picture of a coworker, Patty, who a lot of people know on the reservation. And so it was a very local type effort on the fact sheet. Then one of the things I learned a lot by going around to all these buildings on how to manage the buildings to keep the air from coming in, the smoke from coming in. A big one was limiting door use and which location of the door you actually use. A lot of our buildings have the vestibules for winter to keep the cold air from coming in, so they have the double door system. Well, that actually works really good for wildfire smoke also. But you got to use that door instead of all the side doors. And so when I started explaining door use to people, it became pretty obvious to them that, yeah, we need to limit our door use and keep the smoke from coming in. The air conditioning systems were generally not made for big buildings. They were a lot of house units. Their filters weren't designed to filter out smoke. Mostly the filters were designed to keep the dust off the fans so that they wouldn't go out of balance and ruin them. So we ended up shutting off all the air conditioning units to all the government buildings across the reservation and just keep the smoke out that way. The time of day was important because people would manage their buildings differently in the afternoon when during the height of the fire all the air was being sucked up to the fire, so it was pretty clear air. They'd end up opening all their windows and doors and putting a fan in and blowing the clean air in and pushing the smoke out through the back windows. Wearing masks indoors, people didn't like that. It's hard to do your work. Portable air cleaners, they sold out really fast all over eastern Washington. Unfortunately, some of them generated ozone because of the ionization settings on them. So I did a lot of talking to people with air cleaners to make sure they didn't use that option on there because you just didn't need more ozone in your indoor environment. Towards the end of the fire events, industrial air scrubbers started coming into the area. And those are the big units, are 4 feet by 4 feet and a couple feet tall, push a lot of air through there, have HEPA filters. And they're really good for cleaning out entire buildings. They have that capacity. They are very noisy, so you got to be particular where you actually put them. And then I was thinking of trying to figure out how to create a positive air pressure inside your building during these events, and I'd be happy to speak to anybody that has any good ideas on that, on how to create positive air pressure inside a home or a small office building just to keep the air from the wildfire smoke from coming in. So one of the biggest lessons I learned is prepare early for the next wildfire season. And I did that by putting together a standard operating procedure to get a lot more sophisticated than my steno pad. The SOP includes what to measure for, how to measure, how to manage the data, how to report it. Also got a better data form than the steno pad. So added the carbon monoxide, carbon dioxide notes. One of the other fields on here that doesn't show is who you contacted in each building and their contact information, their phone numbers. I didn't know everybody I talked to, and that would help to recontact them later because there's always questions. And those people had tended to go to their supervisor and say, this is bad air, we shouldn't be here. So you need to have that in mind too. Try to provide some health guidance. Pretty much use the AQI health messaging, even though those are designed for 24-hour averages, they still provided people with some idea on how severe the air quality conditions were and gave them some guidance on that. I'm still refining some of that messaging because I want to make it better for people and a little bit more clear on what they should be thinking about during those times. Also distributed to all the school districts in and around the reservation the guidance for schools that are put out by our Washington State Health Department, and I think most states in Pacific Northwest also have those guidances. They vary a little bit from state to state, but they give directions on recesses and sports and when you should consider not having outdoor practice and canceling games. I also gave out a lot of wildfire smoke brochures that we had developed the year before from the 2014 wildfire season we had, which also provided health messaging, what you can do to minimize your smoke. We had about 600 of those when I began, and we actually put 400 of those brochures into people's hands directly, so that was a big effort. And I think it made a lot of difference on how people treated wildfire smoke. So now I have a sampling toolbox to do the next event that comes up, which we didn't have to do in 2016, so that was really nice. So I have my Aeroset 831, carbon monoxide, carbon dioxide sensors, clipboard, my education materials, and data sheets, and the cell phone. I found out having the cell phone is very important because as soon as you walk out of a building, someone's going to call you because the person you talk to in that building talks to them, and they want you to come over and measure air quality in their environment. A couple of other things I've done, I've put together an Air Resource Advisor fact sheet for, concerning the reservation. So when Air Resource Advisors come into the area, and in 2015 we dealt with a lot of them because it was such a long fire season, and they rotated about every 14 days. So this will just make it easier for those people to come in and know what my air quality program in the environment of the reservation is. So it provides the local contacts, description of the reservation, regulations, because we're governed by the Clean Air Act and the Federal Air Rules for reservations. And off the reservation, it's Washington State Department of Ecology, where the air quality monitoring sites are and how to get the data, and then the map of all the communities in the area that might be affected. The small communities that 200 people, 300 people are very important, I feel, to have them identified. Then later, we, as an appendix to that, I put together a listing of the air quality sites in eastern Washington and all the meteorological sites for weather data on and surrounding the reservation. That ended up pretty extensive, and that could be also used by the incident command team. And since then, I've gained delegation for several parts of the Federal Air Rules for reservations as part of the Clean Air Act. And now I can issue air pollution alerts, warnings, and emergencies, and I think that will help greatly on the health messaging during these big fire events. So now I can just relax because life is good, and I'm ready for the next indoor air quality wildfire smoke events. Thank you.
Sounds good. Thank you. Pete, if you don't have any comments, we'll go directly to Shelly and then have questions at the end. And I've muted you, Pete.
Just fine.
Okay, great. Okay, Shelly, do you want to go ahead and share your presentation? And you should also be able to speak now.
Okay.
There you go.
Let's see, share. PowerPoint, share. Okay, do you see this?
It's good now, thanks.
Okay, thank you. That was a really interesting presentation that you just made, and I really appreciated all the effort you put into that work. It's super important, and the work that I'm going to talk about will substantiate your approach. I think it's great. So I'm going to share with you some research that we did a few years ago now on the impact on indoor air quality in Colorado from wildfires and prescribed burns. The objectives of this study were to measure indoor air quality of PM 2.5 while wildfire smoke was present and determine whether the indoor mitigation measures of keeping windows closed or using an air cleaner would help reduce exposure to PM 2.5. The way we did the experiment was we looked for a fire that happened during the summer of 2002, 2001 or 2, and then we would drive to the site and identify 2 recruits who could let us into their home to study their home. And most often, it turned out to be some of the firefighters who were on the fire that let us use their home. In one of the houses, we would put an air cleaner, and then we would make sure that the residents also kept their windows closed. And we would monitor indoor and outdoor PM 2.5 during the fire. This is a picture of our experimental setup where we were measuring PM 2.5 mass with Harvard impactors. We were measuring particle concentration with climate counters and CO2 to get an air exchange rate in the home during our measurements. I wanted to talk a little bit about the air cleaners that we used. These are the Frederick ESP air cleaners. They're very efficient, but they also have to be maintained well and cleaned often. Otherwise, they will, once they get dirty, will begin to generate ozone. So it's better probably to use a HEPA filtration device. But in any case, this one had a clean air delivery rate of 420 cubic meters per hour. And this metric is important so you know how many air cleaners to install in the house to make sure they're cleaning the indoor air quality efficiently. And so some homes we would install 2 of these, and some homes we would install 3, depending on the size of the home. And just by way of background, you study how air cleaners perform by looking at their effectiveness, which is what we did in this study, where we would compare a concentration that you measure when the air cleaner is running compared to one that you don't. On this slide, it's C reference is one where there's no air cleaner, and CAC is when there is an air cleaner. And the clean air delivery rate is something that the American home appliance manufacturers will document and then publish on the device. And let's see if I can move to, here's the rating. So you'll see this on the box, and it will tell you what size of a room you should use the air cleaner in. And so this is a useful rating for people to know whether the air cleaner will work. And so this rating here shows you can use this air cleaner in 120 square feet, and it will reduce the pollution levels by about 80%. So the fires that we studied was the Polemus prescribed burn, and you'll see this picture here showing where the fire was. And then we also did the Schoonover wildfire the following May. And here's a picture of the smoke from those fires. We also studied the snaking fire, and you can see on this slide the location of houses 3 and 4, how far they were away from the fire, and they participated in our study. And here's a plume from NOAA. The Hayman wildfire was the largest wildfire at the time. We've since had many more larger wildfires since this one. And we studied this fire and looked at houses 9 and 10 on the map here you can see. And you can see the proximity between the Hayman and the Schoonover and the Palimas prescribed burn, which were the fires that we studied. And this video, we'll see if it plays, but it shows the evolution of the smoke plume during our study. And that's it. Okay, great. So in order to understand the impact of the air cleaners on the home and the indoor air quality during the fire, we did the following. We had house A that had an air cleaner, and we measured the air quality inside and outside of that home. And then we had the second house very close to house A, which did not have an air cleaner, and again we measured indoors and outdoors. And then we compared the measurements between these two homes to try to understand how the air cleaner worked in one home compared to the other. To understand how the window closing event might impact the exposure, we took house A during the fire and we measured the indoor and air quality in the home. And then after the fire, when there was no smoke, we measured the indoor and outdoor air quality as well. And then we made comparisons between these measurements, and it tried to help us understand what the impact of the window closing would be. So this is the data from the prescribed burn, and on the y-axis we have 24-hour average PM2.5, and we have inside as the white and blue as the outside with the windows closed. You can see the PM2.5 was about 23. It's much lower than the levels we were seeing in the previous talk, but still significant when with the people inside as to affect their health. And then these are the background measurements, and you can see an elevated indoor air quality event due to cooking, which is a significant source of PM2.5. And then this is the time evolution of the particles in the Palimas prescribed burn, where the peak occurs around midnight due to the inversion, and the inside shows similar behavior of particles infiltrating during the night. In the snaking wildfire, we studied it for 2 days, and what we see in this slide is the percent PM2.5 reduction across all the homes that had the air cleaners. And so the percent reduction ranged between 60 and 80%. So it was able to drop the indoor concentrations by a significant amount using these air cleaners. And here's the data for the Hayman wildfire. Again, we see that the indoor PM2.5 with the windows closed is close to 25 micrograms per cubic meter, and with the air cleaners it drops to about 3. And this is the background data where there's no fire around, and we have a PM2.5 around 5 micrograms per cubic meter. So in this slide, what I wanted to show was that the indoor PM2.5 is elevated during the fires in homes without air cleaners. And here you see that the indoor levels are equal to the outdoor, so the 100% means that indoors and outdoors are the same. And then it can be as low as about 50% indoors compared to outside, depending on what the home air exchange rate is. So the homes, oops, let me go back. The homes that had the highest air exchange rates show the highest infiltration, meaning the indoor PM2.5 is very similar to the outdoor PM2.5, which is the 100% and the 92%. And we do see across all the homes that we studied that the air cleaners reduce the indoor PM2.5 between 60 and almost 90%, which was a very nice result, which substantiates the idea that, you know, using air cleaners during these extreme events is a really good approach if you can get an air cleaner and get as many as you need. And finally, we do see that windows closed, you know, is a reasonable thing to do, but again, it really doesn't protect very well. We have the PM2.5 reduction being as low as 18% and up to 50%. If we have a sensitive population that we're trying to protect, this will not help. And so just to summarize this study that we did, that indoor PM2.5 was elevated during the fires. The indoor levels were 57 to 100% of outdoor concentrations with closed windows. Air cleaners reduced indoor PM2.5 by 60 to 80 to 90%. And closing windows will provide some protection, but really we need to have much better mitigation measures when the levels get so high during fires. And so that is what I wanted to share with you on that particular study. And Liz, if we have a little bit of time, I can tell you what we're trying to do this summer, or we can just stop here.
Since we might run over the end of the hour, it's probably a good idea to do the whole presentation and then come back at the end during the question session, maybe?
Okay, I only have a couple more slides to show you what we're planning to do this summer, and then maybe that would be helpful because then you could give us some suggestions or help us to make sure that this study is successful this coming year. So the idea behind this study was to understand whether when we do energy efficiency measures in homes to make them tighter so that we decrease energy use, how does that impact exposures during wildfires? And so this is a larger study that we're doing, but during fire season, what we want to do is go into homes. We have 30 fire city homes. We have 15 that are very tight and 15 that are not. And we want to study during the fire the indoor air quality, and on the left I've listed all the parameters that we're going to measure. And then we want to come back to the house and measure the air quality after the fire so that we have something pre and post we can compare. And we'll do time activity diaries. We will have a spirometry test on the residents to know what their lung function is. And so you can see, and we'll do some questionnaires. This is the instrument setup that we have indoors and outdoors. It's just a small, low-cost sensor device that we've built in-house. And in the summer, we practiced, and we did not have any near fires in Colorado. We had a lot of smoke plumes from far away. So this is one event that we did study where we had major fires around the west, but not in Colorado, so to speak. And what we did was go into these homes and measure the indoor air quality. This is the PM2.5 data. So the gray bars is the indoor-outdoor ratio. We can see it's pretty low. And then we're using the parameter ACH50, which is a parameter that tells us how tight the home is. And a high ACH50 means the home is very leaky. And in the left, you see the PM2.5 data from our local monitors. And it shows, it does peak at 45, but typically it'll stay low, which is usual for our region. And here's a particle trace where we see some elevated outdoor events during the fire, and the indoor events also increase. And then finally, we just also measured formaldehyde because we wanted to investigate that pollutant as well. So this is some data that shows the highest formaldehyde we found was 29 parts per billion, and the lowest was around 4. So these are fairly reasonable formaldehyde levels so far. And that is it for this study. We're going to repeat it and hopefully get our 30 homes in this summer. Thank you.
Pete, I've unmuted you. Do you want to go ahead and lead the Q&A? Or I guess folks just jump in. If you have questions, you can either unmute yourself or type in the...
Sorry, I was on mute myself. I muted myself. Sorry. What I was going to say, thanks to everyone. Thanks for the presentations. This is really valuable to me in my capacity and learned quite a bit. What I was going to suggest is, Kris, and if we can get some of your example products, we'd be happy to put them out there for people to see on the Smoke Committee Frames website, which I think would create a great model for some of the tools that you've developed. And then I'm assuming that there's published papers of the study plan and results from the first study in Colorado. It would be great to have access to those for the community of folks that are on this call today, and a number of folks that were communicating with me about the desire to listen to the recording. I don't know if that's possible to do, but we'd love to have that information available for folks to look at.
Sure, I'm happy to send you a copy of the paper we published on the Colorado fire, no problem.
Great, great. And the bad news or the good news is there may be some fire activity in Colorado this year, so
yeah.
you may get your wish. In fact, some of the high energy release component and other things are starting to peak out there, at least on the eastern half of the state. Let's take some questions here. We actually do have until a little bit after 2 Eastern, but let's fire away. I guess hit your chat is how we've been doing it. I think Sarah has some questions, so maybe we'll just work by chat. Liz, can you keep track of people raising their hand on the chat?
When they're coming through privately, I will post them into the, for everybody, and if I see any that are missed, I'll call out.
All righty.
So there was the one Sarah asked, whether similar home construction was used as a factor, windows, walls, age of home.
Can you repeat the question? Was that for me or for Kris?
I'd say both.
Both. I thought Kris covered it. Oh, no, Kris. Just go ahead and answer. I think, yeah, because yours was the one with the more structured.
So the question was, does it depend on the home characteristics? Is that?
Sorry, my chat keeps popping in and out on me. Wanted to find out if similar home construction was used as a factor, windows, walls, and age.
Oh, We tried, for our study, we tried to use homes near to each other and in the same neighborhood, but the one factor we just had to measure was the air exchange rates, and we have the details of the home characteristics in our paper, and so there are some differences, which does change the behavior of the home, yes.
Okay, and we have another, understand the value of measuring all the other parameters, but what is the purpose of the CO2 monitoring?
This is Kris. I added that because there are health concerns with CO2 and wildfire smoke. There's a large amount of that produced, and some of that stays down at ground level where people are. I'm still learning a little bit about that. In the SOPs, I do have some trigger points identified there to do health messaging from. So that's why I included it.
Yeah, I think that's great that you're including that. There's been some recent studies coming out showing CO2 levels even below 1,000 parts per million, which is typically what you see in a building, has a lot of cognitive impairment related health effects. And so I think that's great that you're documenting that, because that will be a significant impact if you have higher CO2 above, even 900.
Yeah, I think I read that same study, and also with the high PM content in some of the buildings, where all our decision makers were trying to make major decisions, all of that impairs making. So that's reasons I added that also.
Yeah, exactly.
Okay. The question, oops, getting ahead of these here. Question about whether smoke damage was noticed on the interior materials at such high concentrations that you measured, this, Kris.
Yeah, after the wildfires were over, our risk management got a hold of the insurance companies, and they actually provided somebody to come in through all our agency buildings and clean them thoroughly because of the smoke damage from the wildfires. Took about a month and a half to clean all the buildings.
And another one here. I was wondering how people reacted to turning off their air conditioning in eastern Washington. As I recall, it was pretty warm most days. Did some folks find a risk versus reward in making the decision to turn off their air conditioning to improve breathing conditions? In general, how did people react and what conversations took place?
Well, people were definitely not in favor of turning off air conditionings, but it also prevented that haze, of highly visible haze in your buildings when the air conditioners were off. What I found out is some of those building air conditionings were made for homes, and there's not necessarily a recirculation function for recirculating the indoor air back through it, so you wouldn't be bringing in fresh air all the time. Even some of the homes were residents, and they had the in-window air conditioners don't have a recirculation function, or are very good filters for that matter. So there's always that influx of air. Also providing people now with information on how to develop a clean room in their house. You know, buying an air conditioner that sits on the floor, it's not hooked to the wall, not bringing in outdoor air, plus a filter in the room. So you at least have a place where you can go and you can breathe easily during these events. So yeah, it was really hot, really miserable. And surprisingly, a lot of people don't have air conditioning, so they were relying on the windows open or windows closed. And so houses got really stuffy because everybody closed their windows also.
And somebody asked, can speakers talk about the use of do-it-yourself portable air filters to reduce indoor PM? I'm thinking about a HEPA filter attached to a box fan being used inside the house. Cheaper option for those who can't afford more expensive air filters, those in rural areas.
Oh yeah, this is Shelly. I mean, I'm an advocate for trying to make an air cleaner as long as you can have enough fan power to pull the air through the filter, et cetera. I mean, I've had my class make their own air cleaner and then test them to see if they work, and so I think that is a very interesting approach, especially, you know, given the cost of some of these air cleaners.
This is Kris. Yeah, I recently became aware of the volume of YouTube videos on how to make those cleaners. So some of them are better than the others, but they're kind of interesting to watch.
Okay, let's see. Here's another one. During prescribed burns, it would be beneficial to place monitors at various intervals between the burn site and homes monitored to get a better idea as to how terrain plays into dispersion. Stump the experts.
I think that's a great idea. I mean, you know, the prescribed burn is usually planned, but sometimes it's not, you know, I think if you can, that would be a really useful thing to make sure that the smoke is going where you think it is.
Okay, let's see. For Kris, we're doing planning in Ashland for smoke events. We have 20,000 residents. How many N95 air filters do you recommend? What other supplies do you recommend for citizens?
The N95 are the personal mask, and we found that, we gave out thousands of those across the reservation, multiple masks to everybody, because you could only wear one a day because they get dirty, and if you wore them all the time. But we also found that a lot of people didn't like wearing them. If they were trying to wear a mask while working, that was okay until they picked up the phone, and then it kind of got muffled and they took the mask off. And people working outside, vigorously wearing a mask, it just inhibited breathing, so they couldn't work as fast or as hard, and that caused some concerns too. So people would take those off. There's choices. The major thing you can provide people is information. I think that, how to have a clean room in your house, to run your air conditioning properly. Any other specifics, you can think of, health messages are very important. Even people with bad asthma don't necessarily think through what wildfire smoke can do to them. Mm-hmm. In Eastern Washington, if you grew up in this area, you're used to wildfire smoke. And most times it's not as bad as that year, the last 2 years were, 2014, 2015. So those extreme events like that catch people off guard, so they just don't think through that as much. So if you can provide the health messaging to make them aware that they should be considering it, that would big step to keeping them out of the hospital.
Yeah, and I think I picked up on this, Kris, but you were also teaching people how to fit the mask, because I think with the N95 they have to make sure they're fit, otherwise they don't work very well. But I think you were doing that, right?
Yeah, that's one reason we use the local person as a model to do that, to make sure they had the two straps and properly adjusted. There's people like me with a beard, it helps a little bit, but it doesn't help completely.
There was another question here about whether you have agreements in place with organizations like hospitals because of the high IAQ filtration that could be safe havens during smoke events.
We did not have any buildings that we could actually say that were safe havens or refugias for people to go to. We're still looking for ways to do that. It's expensive to retrofit buildings for that. During 2015, our emergency services gave out, 40 or 50 home air cleaners, room cleaners to the elders, so they could have some better air quality in their house. Some of those were used good and well, and some of them were used in a larger room than they should have been. But they all helped. Our health community all banded together, and on the reservation, volunteer nurses went around to elders' homes to make sure they were okay, and people that were at risk that they knew that had problems. So we had a good response from the health community. They've worked with the community service center here and me, and it's a really good partnership, and it did keep a lot of people out of the hospital time. And also the tribe also provided an opportunity for elders and other people at risk to leave. They would pay for a room in a location that didn't have so much smoke, which was hard to find in Eastern Washington. I know a lot of people went to Seattle during that time period just to visit relatives because they couldn't breathe in their houses, and they went over there and they were a lot better off health-wise.
There are a couple of questions here about filters. One is, does particulate concentration change purifier efficiency? Is the equipment efficiency sustained at high particulate concentration? Does this simply become a need for frequent filter change-out?
Yeah, that's a good question. The performance of the air cleaner is not dependent on concentration, but when the filter gets, in fact, with the HEPA filters or the HEPA-like filters that are fiber filters, which I recommend, they tend to work better as they are used longer, until there's too high of a pressure drop, and then you do have to change the filter at that time. And most of them have a light that will tell you when the pressure drop is too high and it's time to change, and so you will have to change it more frequently with higher concentrations.
And then, are there any recommended YouTube videos for better made, do-it-yourself, HEPA filter / air conditioners?
I think you can make a hobby of watching those YouTube videos. Right. So I haven't got any specific recommendations, but there a wide variety of them out there.
Intern project to find the good ones. And I'll question for both speakers, were smoke forecasts used during the fires to warn the public or identify locations to monitor indoor air quality? Which products were used?
In eastern Washington, the area I was focused on, and probably most of the West, the air resource advisors were very effective and essential on these fires to bring messaging. I found on the reservation, if the fire's less than 60,000 acres or, more like 30,000 acres, I can handle all of that work. They get higher than that, they get bigger than that, more complex. The ARAs are essential to have in on these fires. Their messaging are really good, to the point. They do an outlook 3 days ahead of time, a little prediction, so people can have an idea what they might find. They have the tools to do the modeling, which I have to learn every year. These ARAs know how to do that, and they're very good at it. And that's why I did that ARA guidance, just to help work with them a little bit more effectively. So that's the best way to get messaging out. And then what I did is I took their messaging, repackaged it a little bit for the tribal culture and the tribal membership and people on the reservation, and put that out through my networks also. So it got the information out to a broad bunch of people. And then all that ended up on multiple Facebook pages, which were the main way to communicate during these fires.
Mm-hmm. There was a comment from Cindy that the EPA recently published guidance on interpreting and communicating short-term air sensor data. Okay. Just toss that into the.
Yeah, I think that's still in draft, I believe. But
no, it's been published, and I'm sending it to you.
I commented on the draft versions. I haven't looked at the new ones, but yeah, that's pretty essential stuff for the sensors.
They published it I guess in November with the Air and Waste Management Association. But I'm sending those to you and to Shelly, and I also will get them to Pete so that he can distribute them to the smoke committee.
Thank you.
Yeah, thank you for that article that you just sent. I really agree. We started our study because most of the messaging around here during fires was to shelter inside and keep your windows closed. And so we wanted to do our study to see if that was enough, and we found it wasn't, and that you should be using air cleaners. But post-study, I really still don't hear the right messaging about this at all. I still hear the same thing. So this paper that you just sent says that portable air cleaners should be at the forefront of the public health response to wildfire smoke, and I think that we should figure out how to do that.
Cindy, can you put that link in the chat so everybody can have it?
Yeah, I had PDFs, and can I put a PDF in there and they can get it or not?
Link to a PDF, but no.
Yeah,
we'll put it on the smoke committee frames smoke and emissions portal, which will also have a link to this recording as well. So NWCG smoke committee frames emissions smoke and emissions portal. You need to just do a quick search on that and you'll find it.
So there'll be
We'll get that up there.
Okay.
Yeah, I'll send them to who should I send them to? You, Pete?
Yeah, send them to me and Josh, and we'll create a little bit of a resource page associated with this webinar, because there's now probably about 4 or 5 things, maybe more, in terms of resources that people may find useful.
Can you quick type those keywords into the chat so people?
Oh, actually, Josh could probably pull the direct link. Actually, we'll just get you to the page. Josh, you type faster than I do usually if Josh Hyde is on. But yeah.
And there was one more question I had buried down here. Is, were there any specific measurements used to evaluate whether buildings were safe for reentry? I presume that means for you, Kris, after the cleanup was done.
No, we didn't have that guidance. Pretty much as soon as the smoke cleared out, people moved back into the buildings and started working. Then the cleanup crews came through, cleaned them up, but we didn't have any guidance for that. I did go to some of the buildings like the convalescence center after the fire and measured in there, and it was normal PM 2.5 levels, background levels at that time. But that's a good point. We need that. It'd be really good. I'd also like to thank Pete for throwing out a term last spring at our Northwest Smoke Management meeting. He threw out the term at the end of his talk, smoke-ready communities. And to me, that's a very powerful term. And, of course, I changed it to be more tribal-oriented, calling it a smoke-ready reservation, because the reservation is our community. And I've been gathering information on that, and I'd be happy to have any conversations on how to make a smoke-ready community, or what is a smoke-ready community. It's a lot more complex than what I would originally thought. So I think it's a concept that we should pursue.
Kris, it sounds like another webinar on open dialogue, and maybe we could do a panel on that particular topic as a continuing role here of the smoke committee, and it's probably got a venue to get the folks, and maybe we could chat about that. I certainly can lead that off, but your experiences are really important in this, and specifically a very sensitive population. So I mean, I think that maybe we can brainstorm a couple of other speakers for some brief panel discussions and, build more on what we've got.
This seems like a good thing to tie in with the Fire-Adapted Communities Learning Network, too. The folks who would probably be interested in hearing, if not even being involved in some.
I think that would be great, Liz. I think that there's value both in the wildfire side of things as well as in the prescribed fire, and I think that, there's probably some level of differences between the two, but I think that this will give us an opportunity to, to highlight some of those differences and how we can be progressively addressing smoke.
And the community's work is in the getting people ready for other parts of wildfire. This is a critical part of it, yeah.
Yep. Yeah, I would definitely want to touch base with my prevention folks and some of that's going on as well. I think there's a great crossover here. So ties to the cohesive strategy, I could just go on forever. So do we want to grab any more? Can we have any more last-second questions? We'll close out at 15 after. That's when we basically turn into pumpkins here, and there is some work for the NWCG Smoke Committee to resume some of their normal call that occurs at this time. So we got any more? Liz, anything else pop up? I haven't been tracking the chat while I was running my...
Only after you said that. We've got one here that's from Darren Borges, I imagine. I know that both Chris Chambers and Allison Lurch with City of Ashland FAC are at a CWPP two-county planning effort, but we'll make sure that they know about this presentation.
Okay.
And thanks. Smoke resilience is key. Oh, and a comment that can learn from the literature on resilience to extreme hot weather.
I'd like to make a pitch to the group online. There is the International Association of Wildland Fire, someone who's partnered with us on the International Smoke Symposium that we held this past fall, and we'll be doing another one of those, so everyone feel confident in that. But they're helping to host the Cohesive Wildland Fire Management Strategy workshop in Reno, Nevada. I think that's in April. I don't have the date right in front of me. But this smoke-ready concept is one that could be very valuable for that dialogue, since, how to live with fire is really the underlying principle of the entire cohesive wildland fire management strategy. And, living with fire also means living with smoke, and how do we best address that? So maybe there's some traction there for some of these topics or the findings of a panel on this webinar, but I certainly have some good ties with IAWF and some of the organizers of that effort. And if you're trying to, be in tune with how, communities are thinking about fire, the efforts to make fire-wise communities, to look at ecological resilience and create fire-adapted communities, this is all, that's all going to be part of that effort. Smoke is a pretty important piece. I have not seen, not on the selection committee for talks and panels, but I know that there were some smoke topics that were being talked about being proposed. But I'm happy to bring that to the attention of the folks there, because I think the smoke piece is only going to increase importance for all of us as we have to deal with the landscape that we've got surrounding us, east, west, north, south in the United States, as well as international emissions. So I urge you to take a look at that particular conference and see if there's a place for this particular topic and learning on it.
Is there a link for the Smoke Ready IAWF effort that anybody knows of?
No, there's not a link at this time.
Okay, great.
So, any other questions come up in the remaining 5?
Nope, I don't see any more. But
all righty. So I'll do closeout here. Liz, thank you so much, and the Nature Conservancy for hosting this. Blaine, our representative on the Smoke Committee, thanks for facilitating this. I saw a lot of people on here. I don't have the capability to figure out the numbers, but I estimated it. Exceeded 125 by my count. That's a really great participation level, and I appreciate all who sat in on this and listened. I certainly learned. To the presenters, thank you. I think this is the beginning of a dialogue rather than just a closure on this particular topic. There's a lot of depth in our needs in this particular arena. As kind of a de facto leader of the Wildland Fire Air Quality Response Program and the Air Resource Advisors that Kris mentioned, I want to say that this is critically important to us as in that role, and getting the message right and conveying how we can protect ourselves when the smoke levels get to some of the extremes that do happen near wildfires and near the severe wildfires that we can sometimes get. Not all incidents get Air Resource Advisors, unfortunately. We're working with the various incident management teams and agency administrators to increase people's awareness about that opportunity and the importance of doing that. And bringing in an Air Resource Advisor to focus on the smoke issue, be it health-related issues that have been discussed today, but also safety-related issues such as smoke crossing roads and resulting in fatalities when it combines with meteorological conditions to create literally whiteout conditions on the road. Smoke can be both a health and a safety issue. It's one that I think we'll have increasing focus on in the future as we've been growing by leaps and bounds in trying to address this impact. And so that's an important program that I'm certainly promoting, and a lot of the folks that are on the call today. I appreciate your time and continuing your education as Air Resource Advisors, because I've seen a lot of names that are part of that cadre. And feel heartened in the words from Kris. I think we do a great job. We can always improve, and we'll have some more tools to discuss amongst that community from just literally the webinar here today. I think it helps convey important messages and some of the resources that we'll share from Kris and all that have shared some resources on the chat, and you know, get it to us, get it to me in specific, and we'll try and link it into the follow-up posting on the Smoke Committee emissions portal and make it available for everyone. So I want to say thank you for everyone's attention, and for the Smoke Committee, I'll open up or Josh will open up the other line, and we'll continue our committee discussions.